Well, thank you so much, everyone, for joining us to a joint Ontario Workplace Health Coalition and WSIB Small Business Financial Incentives webinar. I'm really happy to introduce this webinar because I am both a board member of the Ontario Workplace Health Coalition, and I also coach some of the members that are involved in the Health and Safety Excellence Program. So I have a great view of both sides of things. So really what I wanted to do is highlight that the Ontario Workplace Health Coalition, what we do, a little bit about that, and then introduce the WSIB to talk about the program and how it aligns with our wellness focus. I'm Monica Szabo. I am president of Szabo SOS and also a board member of the Ontario Workplace Health Coalition. And Tyler Beauchamp and Vanessa Blount will be presenting on behalf of the Health and Safety Excellence Program. So I welcome them to the webinar. I just wanted to share a little bit about the Ontario Workplace Health Coalition. And really our vision is about bringing value to employee mental, physical, and psychosocial health and making it a fundamental part of organizational success. We want all the organizations that we communicate with or work with to adopt and implement a comprehensive approach to a healthy workplace as an integral part of their business strategy and operations. I do encourage you to join us on social media, like us on different platforms, because we do actually offer many free events where we share information about workplace health, what's new out there, any research that's been done, and just to share things that are happening across the board, specifically focused around wellness. And there's on the slide deck, you can see a few different things that we've done, like virtual events, lots of social media posts. We also hold focus groups and podcasts that you can listen to and participate in. And we meet on a regular basis, almost once a month throughout the year. The board member get together, and really we're talking a lot about environmental, social governance, or ESG, diversity, equity, and inclusion, which is on the top of many organizations' minds. And we're trying to focus some attention on small and medium-sized enterprises, and possibly the WSIB will talk about that, on how to actually make sure these programs are implementable by smaller and medium businesses as well. And just to introduce our healthy workplace model, and the Health and Safety Excellence Program is also based on this model of Plan, Do, Check, Act. It is a health and safety management system that has been used in the safety world for a long time. And what we want to encourage is to include all the 4 elements in your Plan, Do, Check, Act cycle to make sure that occupational health and safety, and also healthy and lifestyle practices, organizational culture, and organizational social responsibility are included in your journey and integrated into the way that you do business. So I will hand over the presentation to Tyler and Vanessa to talk about the Health and Safety Excellence Program and a little bit about how wellness can be integrated into that journey.
Awesome. Thank you, Monica, and thanks to the Ontario Workplace Health Coalition for the invitation for us to be here today. We're excited to share some updates from the WSIB's Health and Safety Excellence Program that came into effect to help small and medium enterprises to develop occupational health and safety programs into their business following that Plan, Do, Check, Act model that Monica talked about, while getting significant financial rebates through the WSIB. So we're gonna share my screen here. You should be able to see it now. Before we do jump into the bulk of the presentation, in the spirit of truth and reconciliation, want to acknowledge that the land that we operate on today and all of our offices across Ontario are on the traditional territories of First Nation and Métis people and the residents of many Inuit people. We recognize the past history, the vibrant spirituality, the culture, and the stewardship of the land of all Indigenous people. We are committed to reconciliation and growing new relationships, partnerships, and understanding to achieve prosperity for all. So would highly recommend and encourage you to take a moment to reflect on the Indigenous communities in your areas. So a little bit about WSIB, before we get into the Excellence Program. The WSIB, if you don't know, is an independent trust agency of the Ontario government under the responsibility of the Ministry of Labour, Immigration, Training and Skills Development. So that means that we operate at arm's length of the ministry. We are here to help. So when an injury or illness happens on the job, we move quickly to provide wage loss benefits, medical coverage, and help to get people back to work. We cover almost 5 million people in more than 315,000 workplaces across Ontario. But more than that, and more importantly than that, we also raise awareness and promote health and safety in the workplace with a goal of keeping Ontarians safe while they work. So that is our vision. Our vision is to help make Ontario the safest and healthiest place to work in all of North America. We operate under 4 key values: to be compassionate, to work with integrity, to always be helpful, and earn people's trust. Like I said, our #1 mandate under our Workplace Safety and Insurance Act is to promote health and safety. So it's with that mandate in mind that we developed the Health and Safety Excellence Program. Before we really dive into that, I want to take a minute to talk to you about like this image. And I think it really shows, how you can benefit from our offerings in a really simple way. Essentially, what you look at is a plant, and what you see at the top of the plant is the benefits that you will reap from implementing health and safety programs in your business. So all of that root system, everything underneath the surface, is the work and the foundation that you'll lay to make sure health and safety practices are embedded in your organizational culture by involving employees and in your health and safety system, and really making sure that your everyday business operations consider health and safety in mind. And then with that work, that foundation that you'll lay, you'll get the fruits of your labor, which is the plant and the flower above. WSIB is here to help and make it even easier for you to implement health and safety best practices through the Excellence Program. If you think about it, why is workplace health and safety top of mind? I wonder what brought you specifically to this webinar. The pandemic really highlighted health and safety for everyone. It wasn't too long ago that we were not inundated with constant reminders to make sure that our workplaces were healthy and safe, but not just our workplaces. People are now more cognizant of their own health and safety, whether that be at work or whether that be with the businesses that they choose to operate with. And so whatever work that it is that you do, health and safety really should be a priority for your business, because you want to make sure not only are your employees safe, but the customers that you work with and the people that you do your business with are acting in a safe manner. Health and safety is not just about complying with legislation. It does make financial business sense. The work that you do to improve health and safety will reduce your injuries and illnesses, of course, but it will also have additional benefits. We'll talk about a little bit later how investing in health and safety will have a intangible return of decreased absenteeism, improved productivity and profit, and increased employee morale and customer satisfaction on top of the tangible financial returns, which you'll see are quite lucrative as well. I'm going to jump into the Excellence Program. This program is a voluntary incentive program that is available for all businesses who are registered with the WSIB. The program is designed to help you protect your employees and customers, to build a health and safety culture, like I was talking about. So where everyone from your CEO to your frontline staff is involved in health and safety. We're going to work together collectively to reduce injuries and illnesses, and help you make sure that your workplace is not only compliant with your health and safety obligations, but thriving and having a culture that understands the importance of health and safety. So with that, I'm going to pass it over to my colleague, Vanessa, and she will walk you through exactly what the program is and how you can benefit.
Thanks, Tyler. So yeah, we're going to talk about the program itself for a few minutes. It's one way that you can invest in health and safety by participating in WSIB's Health and Safety Excellence Program. So in a nutshell, on top of the investments and the rewards that Tyler was talking about, those tangible and intangible benefits, this program actually also rewards you with rebates on your premiums for doing that work, for strengthening your workplace health and safety practices. So there are 36 topics in the program, and I'll share a slide on that in a little bit, across these 3 levels that you see up there. And basically it's built to help you have a robust health and safety management system, and it's also aligned with the ministry's accreditation program. So one thing to note too, you're not going to be doing this alone. When you enroll in the program, you'll register with a WSIB approved provider. And again, we'll touch on that in a few slides, but they'll be guiding you along the way in the program, giving you the support you need to be successful in the program. And really the idea behind the Health and Safety Excellence Program, it's a journey. It's meant not to be sort of like a one-stop, I'm going to do this course, I'm going to get my certificate, and it's going to sit on the shelf. It really is meant for you to continue your work, to build on those foundations, so that it's living and breathing in your organization. So level 1, which is foundations here, really helps you to lay the groundwork of a basic health and safety program. It does include many of the legislative requirements, but also things like performing your risk assessment and then controlling hazards in the workplace based on that assessment. And it allows you to go beyond the requirements to uncover the causes of workplace injuries and illnesses that Tyler was talking about that you want to avoid, and that we really also want you to avoid, and taking the steps to address them. Level 2, which you see here, is intermediate. It's where you start to work on a health and safety management system, meaning you're really integrating your health and safety program into your processes, the operations, and activities of your organization. And that is actually the step that has the most topics, and I'll show you what those topics are in a few slides. So level 3 is where you optimize that system so it's truly working to continue to prevent injuries and illnesses. And that means you're going to be working on integrating processes where you can continually assess and control your hazards and ensure a continual improvement process. So again, topics are building blocks towards ministry's accreditation program. There's also some unique topics that are offered that go above and beyond the legal requirements. We'll talk about those in a few slides. So whether you're starting from scratch or you have a plan in place that you want to build on, that's how this program was designed, to be flexible, to help you where you are to meet your needs. Next slide. So for every topic you develop and implement in your workplace, you'll be eligible for a rebate. So when you finish a topic, basically that means you've gone through those steps that Monica talked about, and Tyler's going to talk about those too. You'll provide us with a write-up of the work you've done, and often you'll hear us call that an evidence story. And once we've seen that and we've confirmed that you've met the topic requirements, which are outlined, and your provider will help you take you through those, you'll be eligible for a rebate. Now they're different for everyone because they're calculated using the amount you paid in WSIB premiums the previous year. So the rebates this year are based on your premium amounts for 2021, and then your rebates next year will be based on your premiums you pay that year, and so on. So the equation for working out rebates is a bit complicated, so we're not going to get into that detail here. But what I will say is that we've set a minimum rebate of $1,000 per topic. So even if your premium rates are really low, your rebate will be no lower than $1,000 per topic, or up to 100% of your premiums you paid the previous year. So this year, we're also doubling the rebates for 2022 for smaller businesses. So those are businesses that have 99 or less full-time employees. So you'll get a minimum of $2,000 for every topic you finish before December 31st. And provided you have an approved action plan in place. So it's important, again, to remind you, you are not doing this work alone. You have a provider that's going to help you along the way. So why do I keep mentioning this word provider? What does that mean? So we have an approved list of more than 20 health and safety associations and companies that will help you do this. And we call them program providers. So you'll choose a provider that's right for you based on things like what your industry's in, your location, the level and type of service you need. And then the providers charge a fee based on the services you'd like. And each provider has their own pricing structure based on the services they offer. So you can work with a health and safety consultant at the WSIB to help you figure out which provider is going to best meet your needs. It's important to note that from a WSIB perspective, we're not involved in setting those prices, and none of the money that you put into providers actually comes into the WSIB. So we don't charge you anything, but we do give out the rebates. So we're also giving members, again, those members that belong to that smaller business community, $1,000 to help pay for costs associated with building your new health and safety plan. So once you've signed up with us through the digital tools, signed up with a provider, and have some topics that you picked and they've been approved by your provider, we'll send you a check of $1,000 towards those fees. You can find information on these program providers on our website. And again, we're happy to help through our health and safety consultants to help you choose the right business to help you through your action plan. Next slide. So another thing I just wanted to mention, Tyler talked about just building that health and safety culture to really support you through implementing these topics and making sure that they're embedded into your everyday work practices. And the best way to do that is to have a good understanding of what your culture is to help you make sure that you can integrate that into your workplace. So we actually have a tool that's available on the digital website that can help you measure your health and safety culture. So again, having a strong culture is key to your business, as well as in-house performance. I did 5 questions. I think there's 13 in total. Is that right, Tyler? If I remember. Anyway, it's definitely less than 15. So it's really easy to fill out. It's easy to complete. It's done online. It's anonymous. And it will keep track, the digital tool will keep track of your scores, and you'll be able to measure them and monitor your performance over time. Now, based on our initial analysis of 5,000 responses of the culture survey results across 500 businesses, we're seeing a strong correlation between health and safety workplace with positive results in trust, employee involvement, and employee empowerment. All of these, which you'll use, especially encourage the use of employees in helping build out your health and safety topics through the Excellence Program. Now, in a recent member survey, 90% of the Excellence Program members reported an improvement in their safety culture. That's really significant, and it shows that investing in health and safety could also improve your workplace culture. Next slide. So in addition to the financial rewards, you'll also get these digital membership badges that you can use to show your customers and your business partners that you're dedicated to health and safety. You'll receive this badge when you first join, and then as you complete those levels that we talked about at the foundation, intermediate, or advanced levels, you'll receive a badge. We call these performance badges when you finish each level. So you're welcome to use that badge in just about any way that you find will be useful. You can put them on your website, your email signatures, you could print them up, you can put them on vehicles, you can make decals out of them, use them in your marketing materials. And really what's really interesting right now is we did a recent survey and people who are looking for jobs right now are also going to look at the health and safety profile of your company. So we have a public website called Safety Check, where you can actually type in a company's name and you can look up their health and safety profile. And on that site, that badge, we put that badge there too. So if there is a prospective employee that's looking at your company, they can see that badge there and know that you're committed to health and safety because you're participating in this program. Next slide. Okay, so we talked about topics a little bit. We keep mentioning topics, using that language. So these are the topics that are available. So again, program's super flexible to meet you, where you are in your health and safety journey. You can implement between 1 to 5 topics each year in the health and safety program. Going beyond 5 would be way too much. That's a big chunk of work, 5 as it is. And if you choose to implement 3 topics, for example, and for whatever reason, you can only implement 1. I mean, COVID happened, that threw a wrench in for a lot of people in their work. You always have the option to defer topics as well to a future year. So we talked about levels, and just want to point out that one of the recommendations that your provider might make when you're choosing topics and they're helping you through that process is that if you look at the intermediate level, there's topics that work well together. So for example, we have emergency prevention and preparedness and emergency response. Bundling those together will really help you. And then there's, for another example, there's 3 return to work program topics. And again, those work well if you're working on them together. Now you'll see the blue highlighted ones there, workplace health promotion and corporate social responsibility. I know those are big topics for your organization. And we're going to talk about workplace health promotion. Now those aren't part of the legal requirements, but we do know from the literature and best practices that focusing on those definitely will help to improve your overall health and safety of your organization. So we recognize mental health's been a huge challenge for many Canadians. Based on a recent 2022 survey by the Center for Addiction and Mental Health, 25% of survey participants reported feeling moderate to severe anxiety, which is significantly higher than was reported in a similar survey in 2021 by 6%. So this is an emerging trend that based on COVID and everything that's been happening, that's not likely to go away, and it is going to have a big impact on your workplace. So by choosing the workplace health promotion topic, it could help you implement mental health supports such as wellness programs and employee assistance programs. Next slide. So here you have an example of some of the types of things that could be included in a workplace health promotion topic that you can include in developing those out. We mentioned mental health promotion, employee assistance programs, psychological first aid, but there's other things that could be part of this, like just health and safety at home, or off the job health and safety, or vehicle safety, driving safety. All those things could be included and incorporated in your workplace health promotion topic. And back over to you, Tyler.
Sorry. Thanks, Vanessa, for going through that. It's a lot of information. This session is being recorded, and you'll get a copy, I believe, of the slides as well. So, don't feel like you have to have everything memorized. But as Vanessa indicated, the program is comprehensive, and because it's designed to be tailored to the unique needs of every business, there's a lot of variables and details that we could discuss, but we're not going to get into that too deeply right now. Once you've chosen your program provider that Vanessa mentioned, they will be able to guide you through all of those details and make any decisions that you need to make to tailor those topics to your business. You'll notice, or you may have noticed, that when Vanessa went through some of the topics, a lot of the work that you probably have already done is captured under those topics. So continuing to build on your success or making improvements where there might be gaps in your current programs can help you, expand on those topics and get those rewards for continually investing in health and safety. But I want to walk through sort of a broad sort of example of what it would look like to implement or develop a topic. So the work that you need to do to implement these topics into your business obviously will vary depending on the topics that you pick. But to keep the process as straightforward as possible, we're asking that members follow a project management tool. So Monica mentioned at the beginning, the plan, do, check, act cycle. This is a common management tool. It's been used for a long time. In healthcare, it's known as a Deming cycle. Some people might call it the plan, do, study, act. So it's a project management tool. So anybody who's familiar of plan, do, check, act or project management would understand that these processes help you break down bigger projects into more manageable bite-sized pieces. So with the plan, do, check, act cycle, you're going to start making a plan and then figuring out what to do. So for an example, let's use that workplace health promotion topic. I know it's a big area of focus for the Ontario Workplace Health Coalition to make sure that health promotion is embedded into your everyday business. So if you want to promote workplace health and safety, you have to sort of figure out where are the opportunities to do this? Where's our current program? What do we want to promote? What are our employees' concerns? So in the plan phase, you're going to figure out, what you want to do, who needs to be involved, and if you need to create a new policies, procedures, do you need to invest in a particular area? So you'll literally sit down and plan what needs to be done. Then you would implement that plan. So in the do phase, you're going to do everything that you've set out to do in your policies, procedures. You may need to provide training to appropriate staff. You'll likely need to communicate the plan and the ambition that your business is trying to do. So all of those activities where you're literally embedding the topic into your everyday business activities will take place in this do phase. So you'll want to make sure that you're implementing the topic appropriately. So once you've implemented that plan, you're going to want to check to make sure you've accomplished what you've set out to do. So are you actively promoting a healthy workplace? So maybe you're doing a smoking cessation program. Are people actually stopping smoking? Is it being effective? Are the communication tools working to highlight the hazards of smoking and why it might be benefit? Are you offering an incentive program? Are people taking you up on that? So you want to make sure that people are actually becoming safer by implementing these topics. Finally, in the act step, you're going to go back and you're going to make any changes that you might have found in that evaluation that you did. So you may realize that, maybe we need to offer communication in different modalities. People are not checking our website, they prefer emails or something like that. Or maybe we found that the barriers that we set up in place to protect us from COVID-19 are not being effective and we need to come up with something else. So you're going to go back and you're going to address those gaps. This is also the step where you're going to acknowledge the hard work that your employees put into helping develop your health and safety programs. Your programs will not be effective unless everyone is involved. We talked about that culture of health and safety. So this is where you're going to acknowledge them and recognize the work that they've done. Now, you're probably asking, okay, well, how much time do I need to do this program? What is my time investment going to be? So we understand from speaking to our members that you'll probably spend an average of about 2 to 6 hours a week, depending on the topics you've chosen. Now, some topics will take longer than others. So to help small and medium enterprises to implement these topics within the time frame that we have set to make sure that you get your double rebates and the most money back from WSIB, we've recommended some topics that we know that you'll be able to implement within the timeline of finishing them before the year. Now, that said, the time to join the program really is now. It's not often that WSIB will offer increased incentives like double rebates and that additional $1,000 for signing up. And right now, the deadline to do that is to have everything completed by the end of the year. So now is the time. There's money on the table. It's imperative that you sort of join now so that you can do the work and get all of the money back that you're entitled to. Now, that said, if you do need to take longer, like Vanessa said, there is options. You don't have to complete it by the end of the year. You will still get the rebates in 2023. They may not be doubled, but you'll still get that minimum of $1,000 and still get the rewards for investing in health and safety. So I want to give some examples of what it would look like this year for completing topics. So as Vanessa mentioned, the calculation to determine rebates can be a little bit complicated. So we'll just mention a general rule of thumb for smaller businesses that on average, you will receive about 2% back on your WSIB premiums for every topic that you complete. But if that 2% is less than $1,000, you'll automatically get bumped up to that minimum of $1,000 per topic. So let's take an example here. We have a smaller employer with 15 employees. They paid $20,000 in WSIB premiums last year. They complete 3 topics. So in this case, they chose health and safety communication, injury, illness, and incident reporting, and then control of hazards. So that's probably controlling COVID-19. So if you take the example here of 2% of $20,000, that's only $400. So they're going to get bumped up to that $1,000 minimum. They complete 3 topics, so 3 times $1,000, $3,000 in a regular year. That's doubled for this year. That's $6,000 plus that additional $1,000 support. So a total return of $7,000. That is a huge financial return. If there are any accountants on the line here, CFOs, for example, you're going to know that this is a major return on investment that is a great opportunity for you to recoup some of those investments that you might have spent, because of the pandemic, or recoup some lost revenue because of the impact of the pandemic on your smaller business. We have another example here. This is a very small constructor with only 3 employees. So last year, their premiums were really low. They paid $1,200 in premiums last year. So they joined the program. So and they complete 2 topics. So leadership and commitment and control of hazards. So again, that 2% back of $1,200, that's going to be really low, $24. So they're going to get bumped up to the $1,000 minimum. So they complete 2 topics, so 2 times $1,000, they would get $2,000, but the program limits you at 100% of your annual WSIB premiums. So they're going to max out at $1,200, which is what they paid in premiums. Now, that's in a regular year. So that's going to be doubled for 2022 for completing topics. So they're going to get $2,400. Plus, they're going to get that $1,000 for signing up in the program. So they're getting a total return on investment of $3,400 on their $1,200 premium. So that's a 2.5-fold return on investment, which doesn't come very often from insurance companies. I don't know about you, but I'm a safe driver. I do take driving seriously, but I'm not getting 2 times what I pay in my car premiums back for being a safe driver. So the impetus really is now to join that program, to be recognized for that hard work that you're doing to keep your employees safe. So we've laid out a lot of information on this call. We are coming to the end of our call now. But if you're still on the fence, if you're wondering, if this program is right for you, I just want to reiterate, regardless of whether or not you join the Excellence program, the Ontario Workplace Health Coalition, they have a lot of free resources for you. We definitely know that investing or making improvements in health and safety will reduce your workplace injuries, decrease absenteeism, like I said, increase productivity, increase profit, and improved employee morale. That's really what it's all about. So even if you don't join the program, we strongly encourage you to look at your business's health and safety programs. Look at strengthening it. Where are some gaps? And if you do think that you could improve your program, consider joining the program. First of all, it works. So as Vanessa mentioned, 90% of our members reported an improvement in their overall safety culture after joining the program. So it works. This means employees are more engaged in health and safety, and they're working safer. We talked about the financial rewards. So those double rebates for 2022, plus that $1,000 for investing in health and safety. On top of that, we mentioned, you're going to attract and retain top talent. There is a current labor shortage that's affecting, multiple industries right now because of the pandemic. You want to retain your staff. You also want to attract top talent. So we know 82% of people want to look at the health and safety record of a prospective business before starting a job with them. You want to set yourself apart from your competitors. You want your staff to know that you're doing everything that you can do to protect them while they're at work. We are aligned with industry standards. So Vanessa mentioned that we are aligned with the ministry's accreditation program, but we're also aligned with best practices. So CORE 2020 is a standard that many firms in construction use, and then the International Health and Safety Standard, ISO 45001, meaning if your business wants to work towards achieving any one of those standards, the Excellence program can help you get there. More important right now this year, because of the impacts of the pandemic, and we know the financial hardship, especially for smaller businesses, you're going to earn a strong return on investment through this program. Investing in the Excellence program means you're investing in workplace health and safety. There was a recent study through the Institute of Work and Health. It was a first of its kind study that looked at the return on investment in health and safety for Ontario businesses specifically. And what they found is that businesses that invest in health and safety through the Excellence program have seen a return on investment of $1.24 to $2.14 for every dollar invested in health and safety. And that's on top of the rebates. So really great return on investment. And finally, and most importantly, I could talk about this last box, for this entire presentation, but you're committing to helping your people stay healthy, happy, and safe. Employees and colleagues really become starting to feel like a family after you've been at a place. You do actually spend more time at work than you do at home, and sometimes. So the people that you work with become like your second family, and you want to keep those people safe, because the impacts of a work-related injury, illness, or fatality are devastating, and you don't want to deal with the impacts of that, because most of the time these injuries and illnesses are preventable. With that said, Vanessa and I could talk about this program and say how great it is, but really we work for WSIB, so you want to hear it from your colleagues. So we have some testimonials here. I really like this one. This is a small manufacturing business. They say, so far from joining to now, we haven't had any safety claims. Normally by this year, we would have 3 or 4 claims to the WSIB. We've had no claims in the last 10 months. So you can see, again, it's working for that business. That's it in regards to the Health and Safety Excellence Program. Like I said, WSIB is here to help you improve workplace health and safety. So to that end, we do have some additional free resources that are separate and aside from the Excellence Program. So one of those free resources is we've partnered with the National Institute of Disability Management and Research, and they're offering some free disability management return to work support for Ontario businesses. So one of those free supports is a free assessment or audit of a business's return to work or disability management program, and then a tailored improvement plan to help you with your disability management. These audits are normally quite costly, and they're offering it for free for this year. Access to these audits are available on a first come, first served basis, and spaces are limited. So if this is something that you're interested, you can click the link on the slide deck here, which will be shared with you, and it'll bring you to the application page. They're also offering free continuing education courses in disability management through Pacific Coast University. There are 25 different courses available. You can take one or all 25. They're being offered for free. So take advantage of that. Another is an online health and safety certificate through Minerva Safety Management Education. So this is an introductory health and safety course. It's available at no cost. Again, they're making their entire course catalog available for free for Ontario small businesses. Time commitment is about an hour and a half for each of the courses. What's great is that you can use these courses to help you develop the topics through the Excellence Program. So not only are you getting access to these courses for free, but by taking them, you're going to show us that you are doing some of the work required for the Excellence topics. And again, I've put the link there to learn more and enroll in those if you're interested in that health and safety certificate. So wrapping up today's session, some of your next steps. As Vanessa mentioned, we are here to help you find a provider that makes sense for your business. We can help you calculate your estimated rebate and help you enroll in the program. As Vanessa mentioned, the rebates are available, the double rebates, I should say, are available till the end of the year. So don't delay. You want to get your piece of that pie of the money that's on the table. We are excited to have you join our community of over 2,800 different businesses across the province that are already enrolled in the program, and you'll be part of a network that's helping to make Ontario a safer place to work. So with that said, I want to thank the Workplace Health Coalition for their invitation.